Good morning, everybody. I hope you had a great weekend. This is the 20th of July. It's a Monday, and welcome to our COVID meeting. We're going to start over here at the board. All right, so this is the data collection on reported new cases of COVID. We'll look at those numbers here in just a minute, but I think everybody is aware of the fact that the numbers are rapidly increasing. And so I wanted to look at it by zip code. Here's our zip code, the 33759. You can see this light blue is Safety Harbor here. Here is 19 running north and south, and Regency Oaks is sitting in this dark blue. So here is what we are beginning to see. We always track Pasco County because if we scrolled up, that Pasco County is even a lighter shade of blue. It's this color. We are surrounded by Hillsborough County, and then what's happening over here in Pinellas County over on the western side, which is bright red. The red is showing where the virus is spreading the fastest, and just in the last week we have gone from this light blue to the darker blue, and if the numbers keep up, it's easy to project that we are going to see Pinellas County, all of Pinellas County, convert to red as well. You can see South Pinellas County has been impacted as well, and we have a region up here north of Trinity that is impacting, south of Trinity that is impacting us as well. So we're looking at the numbers, and this is 1 day behind. And one of the things that has happened in the reporting relationships is the numbers are so large now that they are having a hard time being able to report them timely. And so the reports, which used to come out early in the morning, are now coming out at about noon. And so our COVID meeting, which you see every morning or every afternoon, is actually taking place in the morning at 10:30. So our numbers for the last 3 or 4 days, if you're trying to track this on Johns Hopkins, for instance, and try to balance them, our numbers that we're using are actually 1 day prior, just because it's a timing issue with the numbers. So the U.S. count is up to 3,773,000. That's an increase, a 2-day increase of 196,000 new cases. Here in Florida, it's not much prettier. We're at 350,000 cases, and that's an increase of over 34,000 cases. The vast majority of those occurring in the hot spots that have been problematic from the start of the outbreak. It's all the major population centers. Broward, Dade counties to the south. We can see Orlando, the Tampa area, Jacksonville, Tallahassee, and Pensacola. The areas that do the best are the areas where there's nobody there. Here in Pinellas County, our count is at 13,381. It's up 1,000 in the last 2 days. And in Pasco County, they're stable with about 5,000 cases. The testing continues to improve. 138,000 now tested in Pinellas County. The infection rate is running about 9.7%. So that continues to go up almost on a daily basis. The hospitalization rate is 1,222 in Pinellas, and I want to go back to the board and take a look at that. The two charts that I'd like to look at here are emergency department visits with influenza or flu-like illness and emergency department visits with COVID-like illness symptoms. And let's focus on both of them sort of at the same time. The graph is very similar. You see a steady increase, and we jumped from over 5,000 COVID visits up to nearly 15,000 in less than a month. So those are visits per day. And so why this is problematic is because the ability of the hospitals, both in their acute care setting, their intensive care units, and their specific COVID wings, their ability to handle the number of new cases really determines the outcome of that onset of illness. We are hearing reports that down in Broward and Dade County, the emergency rooms are full and they are not able to take any additional COVID clients. They are moving them to, sourcing them to other hospitals around the state. Here in Pinellas County, we've been speaking with Dr. Khalil, our medical director, and many of you know that he is also the chief hospitalist up at Meese Countryside. And so he is tasked with managing the COVID unit there at the hospital. And he tells us that their capacity currently, although they have seen an increase, they were about 30% 3 weeks ago, they are still in manageable areas. So we don't have any immediate concern for Pinellas County, and Dr. Khalil is confident that that will play out well. One other thing that I want to look at here on the board is you will notice that both in the influenza and in the COVID chart, there has been a downward drop. This is not effective for the 20th. This data runs several days behind. This is probably effective 7/15, something like that. But there was a bending of the curve. This is a leading indicator, and so we might be seeing the beginning of a turnaround and some improvement in these numbers that have just been so high over the last 2 weeks. Okay, so that concludes our look at what's happening with the numbers on a broader scale. To find out specifically what's happening here at Regency Oaks, I'm going to turn it over to Leslie Haas.
Thank you, Brant. Good morning, everyone. So here at Regency Oaks under quarantine, we have 15 residents in the independent living, 9 in the skilled nursing, and none in the assisted living. For staff members, we currently have 11 in independent living, 1 in assisted living, and 7 in skilled nursing under quarantine. For residents experiencing COVID or flu-like symptoms or testing in progress, we have no one being tested or experiencing symptoms in the independent living, none in assisted living, and none in the skilled nursing. For employees, we have 8 in independent living, 15 in assisted living, and 125 in the skilled nursing, and that's due to the bi-weekly testing. For confirmed COVID-19 cases, we have our 2 residents from the past, no one new, and we currently have 13 employees who tested positive for COVID. For overall, our residents, again, 2 positives, but our negatives is 170 for resident testing results. For associates, we have our 13 positives, and for negatives, it's 255, and hopefully we continue to have all of our negatives come in.
Wow, that's exceptionally good news, Leslie. Thanks for sharing that. I'm particularly encouraged by the fact that there are currently no residents and no staff members that have COVID or flu-like symptoms. That's the first time we've been able to say that in several weeks. So positive sign and really encouraging news. We're going to close out today and leave you with a COVID-19 video. I believe you'll find this information useful and impactful. So enjoy the rest of your day, and we'll see you again on Wednesday. Thanks.
Deputy Director for Infectious Diseases at CDC. I'd like to talk to you about the new virus that causes the disease COVID-19. Older adults and people who have severe chronic medical conditions like heart, lung, or kidney disease or diabetes may be at higher risk for severe illness from COVID-19. If you are one of the people at increased risk for serious COVID-19 illness, it's especially important for you to take action to reduce the risk of getting COVID-19 now. The first thing you can do is take care of your own health. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer with at least 60% alcohol if soap and water are not available. Cover your coughs or sneezes with a tissue, or cough or sneeze into your elbow, not your hands. Avoid contact with people who are sick. Clean and disinfect surfaces in your home, such as counters, tabletops, and doorknobs to remove germs. Use household cleaning sprays or wipes according to the label instructions. The next thing you can do is make a plan for what to do if you do get sick. Know who will take care of you if your caregiver gets sick. Talk to your healthcare provider about getting extra necessary medications to have on hand. Get enough supplies too, including enough household items and groceries so you can stay home for a few weeks if you have to. The third thing you can do is pay attention to what's happening locally. If COVID-19 is spreading in your community, stay home as much as possible and avoid crowds. If you get sick with fever, cough, or shortness of breath, call your healthcare provider. If you develop warning signs, such as difficulty breathing, persistent pain or pressure in your chest, confusion, or blueness of the lips or face, these may be signs of serious illness. Call 911. For more information and the latest resources, please visit cdc.gov/COVID-19 or call 1-800-CDC-INFO. That's 1-800-232-4636.